I think we should start. People can still join while the meeting's taking place, but I think most people are here. I'd like to thank everyone for coming along this evening. It's quite short notice, really. So welcome to ladies and gentlemen, the community leaders and residents of Harrow. Welcome to this very important COVID community webinar, which is going to give an update of what's happening in Harrow. I'm Councillor Graham Henson and I'm leader of the council. I will be introducing the people who are here giving updates, but just to say really that this webinar was originally being organised as a community leaders event to give an update, but due to the rapidly rising number of residents becoming infected with COVID-19 over the past few weeks in Harrow, we felt that despite short notice, it would be helpful to give residents the opportunity to understand where we are, but also what the council and the NHS is doing to try and gain some control over the virus. And we should say really, we're probably in one of the worst health and economic crises in over 70 years. It's been relentless. Sorry, it's been relentless for quite a few months, and we've been going on since February, which is now 10-11 months away, and at the moment we're still going to go into next year, having to be very cautious of what we're doing. So without taking any more of your time, the people we have on the call tonight, we have Carol Furlong, who's our Director of Public Health. When people ask me about how we make decisions, it's on the advice that Carol gives us as Director of Public Health. She has access to all the information around not just testing, but all that public health information that we need. So we make considered decisions of what we're doing. And we have Sean Harris, who's our Chief Executive of Harrow Council. And both Carol and Sean will be sort of setting out what we're doing in Harrow over the next few weeks. Before we start, I'd just like to address some housekeeping and functionality issues on this Zoom webinar. To be honest, I'm normally used to Teams, so we're on Zoom tonight. But as attendees for this webinar, you will be able to see and hear the panelists throughout the webinar. You will be on this see and hear mode. In a large gathering such as this will allow the webinar to go ahead without background noise or other interruptions that can sometimes take place when you get everyone in there. So if you have any questions during the webinar, there is a Q&A slot that's coming up on the agenda, but you can also use the Q&A function, which is at the bottom of your screen. Your questions will come across to myself, Carol and Sean, and we will be able to answer those now or get someone to answer it, give the information that we might need. I just ask you that when you are asking your question, please remember to give your full name and the name of your organisation if you have one, which makes it a bit clearer so we know who we're responding to. So without any further ado, I'd like to introduce Carol Furlong, who, as I said, is our Public Health England's sort of Director of Public Health in Harrow, and gives us all the guidance we need, and we'll give you the information that's current around the COVID pandemic in Harrow. Thank you. Right.
Right, £5 fine for being talking on mute. So I'm going to share my screen and show you a presentation. I've got an echo. Graham, are you on mute?
I'm muting now.
Thank you. So hopefully you can see this. Give me a thumbs up, Graham. Right. Yep. Okay. So yeah, I'm going to give you a quick update on COVID-19. As Graham has already said, we're seeing a huge spike in the number of cases, and this dashboard is something that I produce on a regular basis. It shows how many cases we've had in the last week, which is 678. This time last week, we were talking about around about 500 cases, maybe a few less. We've got a current incidence rate of 270, negative 0.1 per 100,000 people. And that compares to where we were at the end of November, beginning of December, when it was about 120 per 100,000. So in the last 2 weeks, well, it's not even in the last 2 weeks, because this only goes up to the 10th. So in the first 10 days of December, we went from 120 per 100,000 to the 270. Now, if any of you saw the reports yesterday and the press conference that the Minister did with Professor Fenton and Professor Whitty, you'll have seen that this only gives you part of the picture, and I'll just come on in just a moment to show you what our latest data looks like. So our testing rate at the moment, we're testing 426 people per 100,000 on a daily basis, on a weekly basis, sorry, not a daily basis. And that's 10% of our population. Now, the higher this number is here for our positivity rate, the more infection that we know that we've got in the community. So really, we want to see this number coming down. We want to see this number coming down. And this number here, 134, relates to people who are over 60. And we're concerned about that rising because they are most likely to be people who've got long-term conditions. They're most likely to end up in hospital if they get infected, and they're most likely to die if they do end up in hospital. So that's where we are at the moment on the dashboard. As I said, the numbers of cases have risen. So this top graph shows the pandemic since the beginning. So we saw this big spike at the beginning, and testing at this point was only happening in hospitals. So we don't actually know how many people in the community had COVID. It's very difficult to estimate. We had that big drop in the summer after lockdown, which was lovely for all of us. But when lockdown finished, we started seeing increases. When universities went back, we saw an increase, and that increase has just crept up and up and up. We've had another lockdown where we saw cases decrease. But if you notice on here, where you can see, this is the 27th. That was the lowest point that we've had, but you'll remember that lockdown didn't finish until the 2nd of December. So people must have been mixing in the 7 to 10 days before that 27th date for the cases to start going up again. The data on the other slide finished about here. And what we've seen over the last 4 days is an increasing number of people with positive COVID tests. Now, all of these are interim data, and the only way that they can go up, the only direction they can go is up. So where we're seeing here 170 cases 2 days ago, that's quite a worrying trend. So this line is likely to get a lot steeper. So I just wanted to say about how we can keep safe and how we can try and break this chain of infection. It's not my job to keep you safe and to stop you getting COVID. It's not Graham's job. It's not Public Health England's job. It's everybody's job. It's something that we can all do. We can all do things that are personal to us, and we can also do things that will impact on the rest of society and our families and our friends and our neighbours. So the more things we do and the more measures that we put in place, the less chance we have of the virus passing on to us. So we think of it as like a Swiss cheese model. So no one measure is perfect, and there are holes in each of the measures, regardless of how good they are. There's always going to be a small hole in that layer of cheese. But the more layers we put together, the less likely all of those holes are to line up, and the less likely the virus is going to be able to pass through all of those layers. So we start with hands, face, space. So physical distance and staying home if you're sick. That is really, really, really important. And that's why it's right at the beginning. That distance is when you're out and about, staying distance so that you don't pass it on to somebody if you're close to them, and you don't get it if the other person's got it. But also that isolation. If you are sick, get a test and isolate. Getting a test and not isolating, you may as well not get a test because you're just passing on the virus. Wearing a mask obviously reduces the chance of you coughing onto somebody or breathing onto somebody and passing the virus on, but it also reduces your risk of breathing it in when somebody else is near you. Washing your hands, making sure that any virus that's on your hands you don't transmit to your face. It's really difficult not to touch your face, but that's what we're supposed to be doing. But if you have washed your hands, then you're much less likely to be passing virus onto your face, into your eyes and your nose and your mouth. If you're in a crowded place, limit your time and open a window. Opening a window is a really good and important piece of public health advice. It may be cold and you might need to wear an extra sweater, or as somebody I was on a conference with earlier today, a scarf and a woolly hat, but it reduces the amount of virus that there is in your environment, and the virus can get outside and therefore it's not going to affect you. Testing, as I said, if you've got symptoms, get tested. Even if you haven't got symptoms, we're going to come on and talk to you about how we can help people identify if they're asymptomatic. So that's if they've not got symptoms, but if they are infectious. Health promotion messages, which I'm also going to show you a few of our Christmas ideas, and quarantine and isolation. I can't stress that enough, that if you don't isolate, then we don't break that train of transmission. And finally, of course, we've got the vaccines coming on board. So the vaccines, they're starting to be available. I think we started vaccinating today in Harrow, and they'll become more available, but you have to have 2 doses, 21 days apart. So it's not like a magic bullet. As soon as you get vaccinated, you're suddenly immune. We're looking at a sort of month or so before you actually develop immunity from having the vaccine. So we still have to follow all of the other public health responsibilities. So I've got a few key messages, which you'll see we'll make the slides available. So we're having this increase in COVID diagnoses. What we've been seeing is that it takes about 2 weeks for an increase in the number of cases in the community to have an impact on the hospital. So this big increase that we've already seen hasn't yet impacted on the hospital. But despite that, around about 87% of our ITU beds are full, and about a third of those are full with COVID patients. So you can see that we are heading for a crisis if we don't do something about it. We are getting more testing available, and for those of you who know Harrow Weald area, the recreation ground where the tennis courts are, we've got a new local testing site there, which gives an extra 300 to 400 tests per day. And so that gives us around about testing capacity of about 5,000 tests on a weekly basis around Harrow. The big thing that's causing the spread is household mixing, and that remains the single biggest source of the outbreak and continuing to drive the pandemic. So don't go and visit people if you don't have to. And that I'm really horrible to sound like the Grinch at Christmas, but if you don't have to mix with somebody at Christmas, even though, you know, I miss my mum, I'm not going to see her at Christmas, and my dad, I haven't seen them since the beginning of the year because they're vulnerable. They live quite far away, and you know, I don't want to risk their health. So think carefully about who needs to be in your bubble, because mixing with other people will spread the virus. If it spreads it to vulnerable people, they'll end up in hospital, or even worse, they could end up dead. And you really don't want to have that on your conscience. So if you have symptoms, get a test, get isolated. And if you have to isolate, even if you've got plans for Christmas where to mix with people and you need to isolate, you have to change those plans, even if it's at the last minute. So our Christmas campaign, which will be launching soon. These are some of the images from the Christmas campaign. I think our comms team have done really well. I think they're really nice images. We've also been working a bit with the University of Westminster, who have come up with this campaign. We were wondering how many people are going to be eating fish and yogurt today, strawberry yogurt as well. I hope it's not a lot, otherwise this campaign won't go down too well. But we'll also be doing a Christmas version, so you can look out for that. So my takeaway message: keep safe, protect your family, protect your friends, protect the whole of Harrow by doing the right thing and passing the messages on through your communities. I'm going to stop here, and Sean is going to tell you about some of the things that we've been doing in Harrow to help you.
Thank you, Carol. That was greatly appreciated. And as Carol said, the numbers are escalating very quickly. And the important part is that whilst you might, if you start showing symptoms and don't get tested, it's very easily passed on to someone else. And if you actually meet someone who's had COVID, and it's a very debilitating illness, you could end up not just in bed for 2 weeks and trying to recover for 3 or 4 weeks afterwards. You could end up in hospital, or you could end up on mechanical ventilation, because that's the only way to keep you alive. So it is important that if you are showing any of these symptoms, that you do get tested as quickly as possible. I'll quickly introduce Sean. Sean's the Chief Exec of Harrow Council, but like Sean, Sean also leads on parts across London as sort of in different areas the Chief Execs do, just the way I do as a leader of a council. So we're heavily involved with health across London, but also across Northwest London, where we've got a very strong alliance of support. And Sean will explain some of that as we go forward. So Sean, over to you.
Thank you, Graham, and thank you, Carol, for that excellent introduction. I will, I think, because of the importance, not apologise for repeating a number of the things that Carol has said, but I'll also pick up a number of other areas. I think one of the things I also want to say as well is that we have deliberately this evening not going to talk to you about the tiers, the regulations, or what you can and can't do. We are very happy to take questions on that, and we've also got our resident expert Richard LeBrun on the line, who can tell you what the technical answer is to all of those questions. But I think one of the things we really want to emphasise is that the conversation that we want to have with you, particularly people who are leaders of the community, whether that's in the faith sector or the voluntary sector, is to emphasise not what people can or can't do, but what we would ask people do in order to be able to be responsible and show the right level of leadership during this very difficult period of time. So Carol has explained in some detail the seriousness of the situation, the massive increase in cases, significant increase in cases of people over 60, increased pressure on the NHS, and the rapid growth in numbers. I mean, effectively, there are three consequences of this. The first one, as Graham has mentioned and Carol has mentioned, COVID-19 is serious. COVID-19 kills people. It's killed somewhere between 65 and 80,000 people in the country to date, and probably over 500 people in Harrow. It particularly targets the elderly and vulnerable, and it also has a disproportionate impact on Black and minority ethnic communities, and it makes lots of people very sick. The second thing that a massive increase in COVID will do is it will overwhelm the NHS. And the reason that's important is it means that not only do people die of COVID-19, it means that people die of all the other illnesses and ailments that they have, because the NHS can't deal with the pressure that it's facing while it's dealing with COVID. And we know that many of, as well as COVID deaths, there's been significant excess deaths as a result of NHS capacity being taken up dealing with COVID. And also that means that people either be unwell for longer, or people may well die of other things. The third consequence is that we will have to all endure greater restrictions. The higher the case levels, the higher the impact, the more restrictions that we will all live under. And that has two big impacts. First of all, it has a very big economic impact. Thousands of people, including in Harrow, have already lost their jobs. Businesses are under threat, and the more we go into higher tiers and have more restrictions, the more impact there are on individuals and businesses. And the other thing, as we will find out from midnight tonight, is we'll all have less freedom. We won't be able to enjoy and live our lives as we might want to do. It'll be more difficult to see family and friends. It'll be more difficult to socialise. So in essence, COVID-19 is serious from a health perspective. In terms of individuals, it's serious in terms of the impact on the NHS. And it also means we all have to live under increasing levels of restriction. Therefore, it's really important that we need to act. And the situation that we faced in Harrow is increasingly serious. Clearly, the government has a role in terms of the policy it makes in terms of national lockdowns and restrictions. But there are choices and issues and approaches that we can take in Harrow that can make a big difference. And one of the things that we want to ask community leaders and individuals on this call to do is to take some really important key messages out to your organisations, whether they be faith organisations, community organisations, and voluntary organisations. And these are not messages about tiers, these are messages about behaviour. And the first thing we want to do is emphasise how important it is to minimise contact with others. The virus is a very social animal. The virus likes people meeting with other people. It spreads by close human contact. The best strategy, therefore, is to avoid unnecessary contact in areas such as work, family, social, shopping, and exercise. Of course, that has to be balanced with people's needs and support. But wherever possible, asking people, particularly at this crisis, to minimise contact with others. The second thing is we all obviously do have to have social contact and professional contact with others. But if we do have that contact, to repeat the message that Carol says, people should wash their hands, shouldn't touch their face, they should wear a mask, they should create space and socially distance, and they should ventilate, preferably by meeting people outside. And if there's any meeting inside, make sure people's windows are open. These two things that we've talked about is about breaking the chain of transmission. That's the key thing that we need to do. If that fails, and inevitably people will catch coronavirus because it's a very contagious disease, and people get symptoms, we need to advise people to self-isolate and get a test. And again, the key symptoms are a temperature, a persistent cough, and a loss of smell and taste. If you or anybody you are working with, or people you know, or messages you get out, if you get these symptoms, it's really important that you get a test and that you immediately self-isolate. But then, as Carol said, getting a test, getting a positive result, but then not doing anything about it is not the answer. If people test positive, they need to self-isolate to start the process of helping to break the chain. And they also need to positively interact with track and trace, so that we can trace the contacts of people who have tested positive, so that they can be told to self-isolate and themselves get a test. The important thing is this works. In the northwest and the northeast of England, cases have come down rapidly over the past few weeks. Yes, that's partly been because of the national lockdown, but the national lockdown didn't make the difference in London and the southeast that it made elsewhere. This is because people have been tested. When they've been tested, they've self-isolated. When they've self-isolated, they've played into contact tracing, and then the people they've come into contact with themselves have self-isolated and got tested. It's very, very important that you help us get the message across to people that testing, self-isolating and supporting contact tracing is a really important part of the arrangements. And our ask to you within your organisations, and we will support you through providing this information in writing and using visual images that we've talked about, please explain this to your congregation, your group, your community, and your friends and family. And as Carol so importantly said, it's not about what we can do or what we are allowed to do, it's what it's best to do. And what's best to do in the current circumstances is to minimise contact and to emphasise hands, face, space and ventilation, getting tested, and if positive, self-isolate. The final thing I want to say as well is that there's also much that the council is going to be doing with other partners to support this process. As a result of going into the tier 3 and as a result of a bid that the council has put in, we are going to be increasing access to existing testing sites for people who are symptomatic, and also hopefully over time increasing more testing sites. We're going to bring in the testing for those people who don't have symptoms through the lateral flow device, and we're going to be hopefully from next week having a place to do that in the town centre, and then also we'll be rolling that out across the borough, and also people will be getting tested in schools and workplaces. We're also going to do a lot more high profile education and enforcement and increase the amount of messaging that people can get there. And for example, through this process, we are very, very keen to emphasise the importance of community leadership, engagement and communications. Myself, Graham and Carol would love to be able to say to you that everybody hangs on our every word and is always very interested about what the leaders and the top people, the Director of Public Health and the Council has to say. We know that that is not always true. And it's the people on this call who people in the community of Harrow really trust. So by working together, you can help deliver these really, really important messages. And the final thing I want to say, which is about a message of hope and a message for the future. The first vaccination of people against COVID-19 took place in Harrow today. Very small step towards a mass vaccination programme, which over the next 3 to 4 months should see well over 100,000 people being vaccinated against coronavirus in Harrow. But that will take several weeks, if not months, to roll out to the point at which we need it in order to generate immunity for people and the community. That is a great step forward. It does mean that we can be optimistic about the spring and particularly the summer, but there is so much to do over the next few weeks to break the chain of transmission now. Thank you, Graham.
Thank you, Sean. We now open it up really to a question and answer session. There is quite a few questions have been put into the box, and I will get to those. We get through as many as possible, and if we can't, we will respond as well as we can. So we'll come back to that at the end of the webinar. We've also been joined by Richard LeBron, who leads our enforcement team in a way, but we haven't really overly enforced. We've been trying to guide people to make sure they follow the guidance that's been set by government, and it's quite a sensible device. There's about the social distance and the washing the hands and making sure people keep that contact to a minimum. But I would say, just before we get into the questions, I think as a leader of a council, I can say this: I've been really humbled by the way Harrow came together in the first wave of the pandemic. In March, we stepped up things we'd never done before. Excuse me, I think I might have to get checked myself, but we came together in a way we've never done before, helping each other, supporting each other. But we got through that first phase by people following the guidance. I know there was a major lockdown involved, but we managed to reduce the numbers, and Carol shows you that on that chart. The problem we face is, as the people move away from that guidance and relaxation and sort of mixing too much, is where we've suddenly seen a massive increase over the past week. And I think the calls we've had with Public Health England over the past few days, I've never seen them so worried about what could happen if we don't get some control of the virus overall. So in Harrow, we're going to talk about what we can do in our part of it, play our part as such to keep Harrow safe. And Sean set some of that out. We've got the lateral tests coming in, the vaccination centres are being set up and should be more up and running in January. But that vaccination in itself, even if you, over Northwest London, 2.2 million people, it'll take 25,000 vaccinations a day to take about 6 months. So it's no reason to lower anyone's guard, believing this is going to be a panacea to what's happening. It's not. We've got to make sure that we follow this guidance quite religiously, or we could see tougher restrictions coming in to try and control it. Because as I said at the beginning, if you speak to those people who worked in the intensive care units, they would tell you why you should follow it. So some people could have a low infection, but others it hits really hard and it has killed people. So we are in a very serious situation. So I'm not being melodramatic. People who know me know I don't do that. But when you see what's coming through, I think we need to be very careful. So if we go to the question.
Could I just suggest, because I've just had a quick look through the questions.
Yeah.
I think there are 2 or 3 themes that it might be quite useful to comment on at the beginning. I might do that and then ask Carol and Richard to chip in if that's okay.
Yes, so yes, I was going to get to that because there's some around schools, there's some around people out in the wearing masks, and some people asking what really is a bubble. What is a Christmas bubble and what is a normal bubble, and probably what is a New Year bubble, and all these things we can sort of help with. So, Sean, did you want to pick out the questions that come through? And then
what I was going to say, obviously there are a lot of questions, and I think having looked at them, I think that all of the questions are very good, and we will get people individual answers. But I think in the time we have available, we're probably helpful to get some themes. So there were 3 things that I was going to say, and then I was probably going to ask Carol and Richard to come in a bit more detail. I think the first thing to say is that there is not one reason for the rising cases. Effectively, it's not care homes, it's not shops, it's not schools, it's not workplaces. Effectively, it's everything, and it's predominantly actually household mixing, which is why we're putting the messages across as we are. But I'll ask Carol to go into a little bit more detail about that. But I think that it is important to understand that it's effectively everywhere, because that's the nature of the virus. So I'd ask Carol to comment on that. And the second thing I would say is that actually in the UK, both the council and the police's enforcement powers in relation to things like wearing masks, in terms of many of the breaches that we see, are actually relatively limited. I mean, unless there are fairly extreme cases, it's actually quite hard to, if you like, police and enforce our way out of this. This is very much about engaging with people and seeking people to do the right thing. People may disagree with whether or not that's the right policy from the government, but that is the policy that we have. So what is important that we can do is to encourage people as much as possible. And I will perhaps ask Richard to comment on that. And I guess the final thing, Graham, is just perhaps to just get Richard very briefly, just to give a headline sense of what some of the key things that people can and can't do within the rules. And I'll have another look through the questions as well.
Excellent, thank you, Sean. Carol, although you're on mute.
Hi, yeah. I'm just trying to answer some of the questions. I'm frantically typing away. Yeah, I think I agree with what Sean was saying. It's about our household mixing. That's really where we're seeing a lot of the infections happening. So it's we're seeing when one person gets it in a household, they tend to spread it to everybody else in their household. So I'll give you an example. We saw a case a week or so ago where we had one adult in their early 40s who had COVID. 2 days later, we had another adult in the same household in their early 40s who had a positive test. 2 days after that, we had 2 teenage children and a person in their 70s who had a positive test, all in the same household. So you can see how one person brings it in and then they spread it to everybody else. So even within your household, you can do things that reduce the risk. Things like being in a separate room, cleaning the bathroom with disinfectant wipes after you've been in there, trying to use a separate kitchen or not using the kitchen that everybody else is using, and just and keeping the windows open and that ventilation message. So trying to reduce the risk of your household. If you then start mixing with another household, you're expanding that bubble. And the number of times that we overlap households means that your effective bubble is just getting bigger and bigger. So if you only see one other household, but that household sees 2 households, and those households see 2 households, our bubble suddenly gets bigger, and you're not just seeing your next door neighbor. What you're seeing is your next door neighbor's friends, neighbor's cousin. They are part of your bubble, and that's more people and more chance of you getting infected. And the vast majority, as I said, are because of people within your household or people in a household that you've visited or somebody who's visited you. We are seeing a few outbreaks in small offices where people are not socially distancing within the offices. Again, if you're in an office, to be COVID secure, if you can't maintain that 2 meter distance and can't have the windows open, if you're in an office where the windows are fixed shut because you've got air conditioning, then you should really be wearing a mask while you're at work. I'll hand over to Richard, and Richard can give you some more information about what he's been up to.
Thank you, Carol. Just to answer some of the questions, there's a lot of questions around face masks and social distancing and what are we doing around this? Now, as Carol and Sean mentioned, it is very hard. The legislation allows certain things. There's a lot of exemptions around face masks, for instance. Now, a lot of the shops, we're getting them to encourage people to put face masks on. But obviously, if someone turns around and says, I've got an exemption, then there's no way of forcing them to identify what that is, nor should they. So it is hard, but this is why communication is key. And that's why I've got officers out 7 days a week. I've got uniformed officers out in the key areas, such as town centres, doing a lot of work. And we're actually looking to increase visibility of officers in residential areas as well. Because as you've heard, it's not just businesses that people are mixing, it's actually in residential homes. It's behind the scenes, behind the high streets. So we're trying to get more presence in those areas and more communication, more leaflets. So hopefully our plan is to work with people rather than against people, but obviously if there are ongoing issues, we do have daily briefs with the police every day, and we will target those areas where the intelligence shows us there's problems. And if people don't listen, then there are enforcement powers we can take, and we have taken. So to give an example, there have been some businesses that have been ignoring us, ignoring the law, and as a result have received prohibitions and received fines. But as I say, it's about getting everyone through this safely and working with them. Now, in terms of tomorrow, I know Sean said we're not really mentioning tiers, but tomorrow people are expecting this massive change because we're moving into tier 3, and you're not going to necessarily see it. The high street will look like the high street. Retail will be open, shops will be open. The big change will be hospitality. You cannot sit down for a meal, sit down for a cup of coffee. It's going to literally be takeaway, click and collect, or delivery. That's going to be the main change that you see when you go out and about. The other issue is, at the moment, you can't mix with households in your home unless it's a social bubble. From tomorrow, you can't mix with other households outside unless it's certain public places like parks, beaches, that type of areas. Now, again, this can be very hard to enforce. As you can imagine, the police have got other priorities to do, and there's only so many areas we can actually look at in given time. So this is where we want to work with the community. You know, where are the areas there's problems, and we're happy to work with the community to address them. Or there's ways of reporting. You can report on the Metropolitan Police website. There's a COVID reporting method, or get on the council website, but we will follow these areas up. As I say, most of it is about education. What we're seeing a lot of the time when we're out and about is actually face masks, social distancing, especially in shops. But we are doing a lot more work with them. And what I've seen in the town centre this week is a lot more face masks being worn, which is reassuring because people are getting a message. And more importantly, they're not wearing them just around their chins now, which tends to be the common theme. So it is about everyone playing their part, everyone doing what they need to do to get through this. And imagine right now, the hospitality sector are suffering. They're going to be going through a lot more pain tomorrow. Now, we don't want that to go to waste because other people are ignoring the rules and not doing what they need to do, which means this goes on longer than it should do. So everyone does need to play their part. So in the next week, you will hopefully see more of us out and about, more yellow jackets to be highly visible, more police out and about as well. So hopefully getting the message out to people that this is very, very important to play your part going forward. And with Christmas coming up and Christmas bubbles, this isn't a carte blanche to meet up with everyone. This is, if you need to meet up with people, you can, but do it in a very sensible way. And somebody's asked, is there an easy guide to what does tier 3 look like? Now, on the government website, there is a very high alert coronavirus tier 3 poster that gives a very good summary of what is and isn't allowed. Now, we can happily send that out to people we've got contact details with, and we'll also be pushing that out through social media from Harrow as well. So it's a very good, easy guide about what is and isn't allowed. So hopefully that will help.
Thank you, Richard. Residents do have the ability to sign up to what we call the My Harrow newsletter, which goes out once or twice a week. And that gives the updated guidance and how to access that sort of data, and also support. And there's a few questions in the chat around, in the Q&A, sorry, around hospitality, because that is the area that is going to be affected as we from midnight tonight. We have asked government for increased support around, it's not just us, all councils are asking for increased support around the hospitality sector, because this is normally their busiest time of year. And with the current restrictions, if they're in place, they won't be able to open, you know, to where they make their most profit really, which gets them through January to March. So we understand that people are at risk. There is a business newsletter that goes out that also shows you how to signpost to support that's available, and also the support that the council's offering through some of the funding we receive. There's quite a few questions left. Sean, did you want to come back and pick some more up?
Yes.
On the next stage?
Thank you, Graham. There's been quite a lot of questions around schools, and in particular the council's policy position around schools. So I just think it's important to say that the government has made it very clear that except in circumstances where schools are required to close because of outbreaks and bubbles may need to be sent home, and Carol may wish to comment on that, effectively the government has banned councils from closing or encouraging schools to close early, and people may have picked up that this week that the Secretary of State actually threatened legal action against a London borough that was encouraging schools to close and start teaching online before the end of the year. Clearly people will have different views about whether or not that's right, wrong or indifferent, but in terms of the position available in Harrow, we are not able to close the schools any earlier than close of play on Thursday. Most schools are taking inset day on Friday. What we are doing, of course, is providing support to schools where they may have particular issues or outbreaks. And I think it is important to emphasise that schools clearly are a place of transmission, because it's where a number of people come together. But again, just to emphasise Carol's point, the main focus of transmission in Harrow is in household transmission. I think one of the other questions that was asked, which I think was very helpful, was where are the outbreaks in Harrow? Where is the position? Again, Carol may wish to comment in a bit more detail, but the reality is it's everywhere. But there are one or two places where we get higher levels of transmission, but that tends to change. But Carol, you might want to just comment on the spread of cases in the borough.
Yeah, basically COVID is everywhere in the borough, and when we look at it in a geographical level, one electoral ward is high one week and then another ward is high the next week, and it chops and changes, so there's no real consistency in it. You know, we're hoping that we can do some sort of targeted asymptomatic testing in the new year, and I'm assured that I'm going to have Carol's hit squad coming out into small areas where we can try and test everybody to identify those people who may be symptomatic, who may be asymptomatic, but have been infected, so that we can get them to isolate even earlier. In terms of age groups, we're seeing cases in all age groups. The lowest cases are in the preschool groups, followed by the primary school groups, and then followed by the over 60s, and particularly the over 80s. Which is good news at the moment, but we're seeing a lot of cases in some teenage groups. We don't think it's transmission within the school, because most of them seem to be within households. So there's usually an adult in the household that is positive. Our biggest group this week is people over 35 to 44, and but last week it was people who were 25 to 34. So there's no real pattern to it. I think it just depends on which family's been infected this week. There's a few questions that I've noticed about vaccination and about when people are going to be vaccinated. So there's a plan, which is the NHS plan for vaccination, and they're starting with two main groups at the moment. So that's people who are over 80 and who are mobile enough to be able to get to the testing centre, and also the NH staff. So we're vaccinating the vaccinators, so that you know that they're safe to vaccinate. And then it will then be rolled out to other people over 80, people who live in care homes, people who are over 75 and then over 70, people who are clinically vulnerable in any age group, and then people who are over 60, over 55, over 50, and then everybody else. We'll be looking at the essential workforce as well, and trying to figure out how we prioritise them to get vaccinated. So people like our social workers, the people who collect your bins, because if your bins are not collected, then that's an absolute nightmare. So we're trying to make sure that everybody who needs to be vaccinated gets vaccinated, and there'll be lots of materials coming out and lots of information coming out as the weeks go by. But I think the majority of people will not be seeing invitations going out until at least mid-January.
Thank you, Carol. There's been a few questions directly to me about schools where other councils have recommended closure. And the virus is spreading differently through different populations, as Carol has just said. And the part is that we can ask schools to do, or advise schools to do things. It's up to the schools to decide. And we know that schools are under a lot of pressure on the basis that if someone does get infected, tested positive, then the whole class is sent home. But we haven't got the numbers that are in some other boroughs, but it is increasing. What we need to ensure that is when the children are sent sort of told to self-isolate, then they do. That is one of the key issues around. The schools are closing anyway on Thursday, and the Department of Education is looking at how they can test more in schools, specifically for teachers, but also any children from families that are showing the symptoms. One of the other questions that's quite important that's come up is around our community and about people that are sort of spreading things by word of mouth, or misinformation by word of mouth, or they don't have access to the internet. And I think that's all our role, really, that we need to sort of speak out and say this is what people should do. The council has been very consistent in its messaging right from the start, through the government guidance around the social distancing, keeping apart, washing their hands, people remember it. And it's sort of making sure that people who haven't got access maybe to IT, or they don't understand them, it's us to reach out to them. So our communications team have been putting out a number of videos in different languages to assist with that. And we've also done some written communication to gone out as well, explaining what people should do. And it is down to all of us really to make sure that we sort of encourage people, our neighbours, explaining to them what the rules are, rather than sort of misinformation taking over. The fake news argument, isn't it? And we don't want that out there, because that would just undermine all the work that all the other teams across the council are doing. And as Richard said, we haven't found that many people in businesses, but if a business is sort of totally disregarding the rules, then we will. But we've also got other legislation we can use to close people down if necessary. And we don't want to do that. It's so easy to comply with a lot of the legislation. It's harder work, but I would ask that people do comply, and then we won't have to enforce. But it's always there at the end of it all, the big stick. We do put a lot of things out on social media, and the information we do put out is very factual. So I mentioned the My Harrow newsletter and the business newsletter that people can sign up to receive. But we also put a lot of stuff out through Twitter, through the Twitter handle, with a lot of things that if you want to share it, it shows that it's actually factually right. And we also do put a lot of stuff through Facebook and even Instagram. And all of it is signed off by factually correct by Carol to make sure we're not putting something out that is wrong. So if someone asks, it's got the evidence base behind it.
Apart from today, when I hadn't checked and the message went out today, calling me the director of pubic health instead of public health. Whoops.
I'm conscious of time. We do have a few moments left. So I thought we might do, there's a poll at the end event test, to ask really, to find out if you think it's informative or we should do it again or not. This is the first time we've actually done this to so many residents, given the information out this way. We would be interested to know what else that you wouldn't find sort of understanding more about the virus or more information around that. I just ask Carol and Sean to sum up really about the messages that people should really take away from this event today. So Carol, did you want to start?
Yeah, I think the message that I want to give is we are seeing a really big increase in COVID cases, and we want to try and get on top of this. And really the only way that we're going to do that is by people following the guidelines, the hands, face, space guidelines, get tested if you have any symptoms, isolate if you have a positive test or if you're a contact of a positive test, and do anything that you can to try and get those messages across to your community. We really don't want to see our hospitals overloaded and our friends and family suffering from this horrible disease. So anything that we can do, it only takes one person to try and stop that transmission, and let that person be you. And Graham's on mute.
Yes,
I'm on mute, Graham. Graham, the only thing I want to add is just to, I suppose, two things. One is to reiterate 100% everything that Carol said. And secondly, I think this has been really helpful because, lots of very enthusiastic and great questions in the Q&A. And I think it's been really useful for us to understand what sorts of questions are coming from the community. Really will help us hone our messages, and this has been a really useful exercise, so thank you very much.
Thank you, Sean. And probably finally from me, we haven't managed to get through all the questions in great detail, but we've picked out the flavour of the areas and the strands people are interested in. But it also gives us better understanding of how to shape our communications going forward and to make sure we can get through. So I would urge you, if you can, to follow the Twitter, the Facebook, the Instagram accounts, just to see, we update that as a quicker way to getting messages out to the community. We send out a lot of information through the My Harrow newsletter and the business newsletter, which is by email, and all that gives you signpost people to the right information and how to get support. And I think that's one of the other ones that come through. The vaccination centres are being set up and we'll be starting in January, and we will use our communication tools to set out how they will operate and how people will access appointments. And at the moment it's through GP surgeries, but moving forward, now we will be supporting the NHS and the GPs to do that. And I think from my personal point of view, I'd like to leave you all, I think, with a message of hope about where we really are. Because, I did say at the beginning, this is probably the biggest health crisis we've ever had in over 70 years. And working together, we got through the first part of this. And I think if we can work together collectively, the council can't do it on its own, the NHS can't do it on its own, and neither can the community sector. But I think working together, we can really make that difference to help other people through. So it's simple things like if your neighbour's got to self-isolate, you might go and help them to get food or something like that, or prescriptions. But also you could signpost them, help them through the council's portals, which will arrange further support. We've got the Harrow Community, the London Community Kitchen, based on sorting out food through the community sector. So people shouldn't struggle on their own. There's a lot of support around. And as long as we all follow the guidance, then I think we can get our way through this virus. And so I'd like just to sort of thank you all for coming along tonight. If people find it useful, we will sort of hold another one. We'll get more used to technology and how it all works. but we could also then focus it around areas of people's concern. And also I'd like to thank Richard for coming along tonight. He's very busy and his team are very busy out every night, 7 days a week, as he says. But also Sean and Carol were working over the weekend trying to get these bids together to get funding to run the testing centres. It doesn't suddenly appear, you know, there's a lot of work you have to do. So it's been relentless, I'll say. And for Samia, who coordinates a lot of our work around the community, and Sumesh, who always shows up as community cohesion, but no, it's an important part. But it's an important message. A cohesive community always gets through all these difficulties. So thank you very much for coming along. Oh, the poll. I thought I mentioned the poll, but I haven't seen how to put it up. So if someone knows how to do that. Also, the poll has turned up. If you could quickly just sort of tick some of the boxes about where it is, and then if we do a further webinar, we'll know where to focus some of our points on. So thank you for your time this evening, and hopefully see you all again soon. Please take care and stay safe. Thank you.